Hey, welcome to Sex, Drugs, and Chronic Depression. I'm Jamie Cartwright, and today Emily Shaver and I are probably going to make a lot of jokes about sexy sex, druggy drugs, and super sad times. Also other mental health related topics, with the purpose being to hopefully make you laugh, maybe teach you something along the way, while keeping it entertaining, and most importantly, we want you to know that you're not alone in this, and we never intend offense with our jokes. On a more serious note, we are likely to touch on potentially triggering subjects, including but not limited to violence, various types of abuse, self-harm, even suicide. Again, in no way do we ever intend to be offensive. In addition, we never mean to belittle any aspect concerning these topics and always try to approach with a respectful manner, as respectfully as possible. Most importantly, if you are in a place right now where you feel that there's no way out, if you're a danger to yourself or others, we do care, and please, I can't implore you enough, reach out to a close friend, a family member, a trusted adult, even if that means calling your local hospital, church, or the National Suicide Hotline at 1-800-273-TALK. Again, that's 1-800-273-8255. And hope you enjoy the pod. Let's get on with that. So,
okay.
How do you feel about Rage Against the Machine?
That's the question.
Yeah, because I know you're Stan, low-key.
Dude,
and I want
I
to
am.
know.
I don't know how much I want to out myself with this on this podcast right now. I told you that. I owned a T-shirt once when I was a teenager.
A T-shirt once.
I owned a T-shirt once that had
Just
on
once.
it that that might have related to that band. I hate that.
Welcome to Sex, Drugs, and Chronic Depressions, my friend. It's more than one depression. Emily has it. I have it. I'm Jamie. That's Emily. Welcome back, or welcome to our podcast where we talk about fun stuff and depressing stuff
at the same time, because life is a series of ups and downs.
Yin and yang.
Yeah.
That's a thing.
Yes.
In a culture that I know little about.
I was gonna say I know shit about any of what the fuck you're talking about right now. Well, in the spirit of talking about things that are both good and bad, we tend to start our podcast with the audacity of this bitch and our moment of praise. Audacity of this bitch. Do you want to talk about
that
thing?
Segue.
Do you want to talk about that thing? Shut the fuck up. I'm not good at
I can talk about what's pissing me off first if you'd like.
Please.
So for the past, 3 weeks now, I've been trying to get my puppy's nail taken care of because it was starting to split. And ended up eventually taking her 3 separate times to the vet to get groomed because I wanted to take her to the vet to get groomed because of her splitting nail, right? She's so afraid of people that aren't close to her or me, or she's very untrusting of others, I should say. And she doesn't like water. She's a princess. She doesn't like to get her feet wet. So she'll even avoid puddles.
I get that.
Yeah, she'll even avoid puddles. And so she didn't want to get a bath, obviously. So we ended up, after these 3 visits over these 3 weeks, got nothing accomplished except for Ruby. She conned me out of some free meds, basically. She got some free puppy Xanax and some free, like... She did. She got
Xanax in it for the high.
Work. The Xanax didn't even calm her down. Like, she was on 3 separate sedatives, and it didn't calm her down. So if we are ever going to have to do anything like that for her, we're going to have to give her injectable sedatives, like, for the future.
That really sucks.
We're going to hopefully be able to get her... Sorry, that was Ruby. Bumped her head into my laptop. Hopefully, we're going to be able to get her conditioned into being able to eventually take a BATH. But, like, yeah, she started coming up to me and, like, biting on my watch and stuff when I was talking about it. So.
Oh, yeah. Oh, poor baby.
She's okay, though. But anyway, now her nail is bleeding. That's in the... I have to give her more meds, like some antibiotics, and they gave me a pain medication for her, too, which she doesn't appear to be in much pain, but it scares me. And I wanted to avoid this... So that's why I took her for 3 days basically off of work too for it, which also frustrates me, but you know.
Right.
As long as she's okay.
That's a pretty shitty audacity.
Yeah, she's the positive side is that she seems to be fine. She doesn't seem to be in any pain. She's still her crazy psycho self. But that's also a problem because she keeps reopening the freaking wound, you dumbass.
Right. And then, like, yeah, no.
So that's why we have to give her some calming medication as well, and it's just a whole thing. But this too should pass.
Everything passes. Nothing is forever.
Yes. What's your audacity? Because I know it involves injury as well.
I fell down the stairs like a big dumbass. I fell right down them stairs. It was only like 3 or 4 steps, and like
Wait, did you fall? Did you fall from the top?
Up. No.
Okay.
No, I was like halfway down, and I fell, and I rolled my ankle like twice, and I have bruises like on the lower third of my leg, and it's rough. I seriously fucked myself up because when I injure myself, I really fucking injure myself.
Yeah, I've seen pictures of the swollen ankle, and I was like, "Bitch, are you sure that's not broken?" Like,
dude, if it had shown up like that on the first day, then yes, it probably was broken. But that was like day 3, and I had been putting like a compression ankle thing on it, which of course makes bruising worse and stuff like that. So yeah, no, I just bruised the living shit out of it, and it looks even worse now. It keeps looking worse, but that's how you know it's getting better.
Is it?
Yes, because the bruising is healing. The bruising is healing.
I'm a very clumsy person, but I've never fallen like to hurt myself that bad.
You fake clumsy.
No, I just like trip over myself like as I'm walking, kind of clumsy, and I don't put myself in situations like stairs per se.
Dude, I told Mike. I've been telling Mike forever. The next place, fuck stairs. Fuck stairs forever. Fucking hate stairs. I never want to get on stairs. I want to be done with the stairs. We're going to have no stairs in the next place.
Fuck a stair.
Fuck a stair.
Just like a carpenter who builds... No. Always thinking ahead. Always thinking one step ahead. Just like a carpenter who builds stairs.
Thank you so much for that wisdom.
Andy Bernard taught me that.
Thank you.
You're welcome.
You, Andy Bernard. What episode is that even from? Why do you have like the most random office knowledge?
I think that's the episode where he transfers to Scranton, where they like merge. It's either that one or it's the one where he comes back from anger management, one of the two.
It's always early office with you.
That's the best ones, B. It's the best ones.
I don't blame you.
I'm just saying.
I get how you feel.
Honestly,
So,
that might be my moment of praise this week since I can't really think of anything else.
go ahead. Tell me, what is your
We
moment of
stan The
praise again?
Office. We stan. I've been
Okay,
watching
yeah,
it all week,
fair.
basically.
Are
And
you? It's kind of like your default show.
it's like my background noise for my entire life.
I wonder how
Literally,
much of
always
it is like
playing.
just right, like how much of it is like deeply ingrained in your psyche.
Dude, see, that's why I say shit like the Andy Bernard quote. Or
Dude,
like
I feel like
today, I don't even remember, but today somebody at work said something and I was going to be like, oh, reaching. Like Michael says to Holly in this one
right.
episode. Yeah. But like, I was like, no one's going to get that reference. Even the one that watches The Office in my like office.
The Office is office. Ah.
What's your
We
moment
talk
of
about The
praise?
Office at The Office.
We do. There's only two of us, but we talk about it and it pisses everyone else off, which is funny.
Everybody else should watch it. It's a good
That's
show.
what I say.
It's a perfect like example of how to build characters. That's more than anything. It's a capsule of how to like build perfect character profiles and do character pieces and stuff like that. I don't know.
Agreed.
I really like that show.
Agreed.
I don't care if it makes me basic.
Same. I don't care either. It's my favorite show. Always probably will be.
You like carry it very close to your heart.
Dude, for real. It's like that show I watch when I'm sad. Because like
Dude,
something always happens that makes me crack up like the first time I've ever seen it.
I get you. So,
what's your moment of praise, though?
My moment of praise is the life-changing magic of sticking with your mental health treatment plan.
Woo!
I finally, for the first time since I had my psychotic break, feel like it has been worth it to go through what I've gone through, and I wouldn't trade what I have right now for what I had before.
Fuck yeah.
Does that make sense?
Yes, and I'm so happy to hear it.
Dude, it fucking took forever. It feels like the longest like 3 months of my life have been, or 4 months almost now. It's been since I like started my manic episode till now. And oh my God, I never, ever, ever, ever have to deal with that shit again. That was so terrible. And I don't know if I could do it again, but I know that I am happy I did. This one time. Once.
I think that now that you're on the proper medication for you and not something that's gonna like actively speed you up every day, like the venlafaxine.
Dude, that was the problem, is that I was on something that was just putting me in a rapid cycle, probably.
That's what I was thinking too. Or like, I remember
We're
when
gonna learn about rapid cycling soon.
I'm excited because also I think that it's good that it happened too, as much as it sucked for like the you in particular. It also sucked for the people around you, because fuck having you around in our lives, because we're selfish. And it's like, I don't know. I knew eventually it was going to be back to like normal, but it was the whole, when you were in the hospital was the scariest part, I think.
Dude, when I was in the hospital was just a scary time for everyone, I think. And especially me, but I also had very little concept of what was going on. Like, there's probably a week and a half of my life there that I do not understand what was going on, and I don't remember what happened either. Which is really scary.
Yeah, and that was probably the same period of time where I was getting like, well, me and your boyfriend were getting like the littlest information, because it was hard probably to
nobody
even get
had
information.
Any idea what was going on inside my head, including me. Yeah. It was really difficult to try and figure out what the hell was going on. And really what happened is I was turning in on myself and ended up in this never-ending cycle of me running into the ground about every trauma I've ever gone through in my entire life.
At least you know what was weird though? You weren't mean or sad, or you were like happy and super energetic and talking about Brazilian butt lifts to the nurses.
I don't know where that even came from though. Like, where did it even come from?
I don't know. It just made me laugh. That was one of the funny things.
What? It's because I spend too much time looking at Instagram models because they're pretty and have tattoos. It's really what it is. I spend too much time on Instagram these days. Oh my god.
Fuck, you're so also a moment of praise for me.
Oh,
we stand a queen who can survive a mental institution.
And come out better, hopefully. I haven't.
You already are better because you know so much more, and I don't know. I feel like it helps you get a better grasp on just knowing.
Yes, and speaking of knowing, let's talk about what the fuck bipolar disorder is and what it's like to live with it.
Okay, because I don't know.
Right, and I really don't either.
No.
I really don't either, because it's a lifelong kind of thing that you don't ever get to have a vacation from. And I don't know what my future holds, but I have lots of information that I've armed myself with now. And that has been my diagnosis. If y'all did not listen to the podcast in previous episodes, I have bipolar disorder, bipolar 1 specifically. And it kind of nails my whole personality, which makes me very happy because it turns out that I'm not just a broken human being, but also, wow, fuck all of this. Fuck my brain. I hate my brain. So let's talk about the basics of what happens to somebody with bipolar disorder. Some clinical information.
Ooh,
so
technical.
Yes. Technical clinical information about bipolar disorder that you can learn from the internet or from a doctor if you want to talk to a doctor about bipolar disorder. It's formally called manic depression, and it's a mental health condition that causes extreme specifically episodic mood swings that include emotional highs, mania or hypomania, and lows, depression. So it's excuse me, I just burped a little bit.
It's fine.
So it's not instantaneous mood swings that we are talking about. These things are mood swings that happen over long periods of time.
So like when you hear people, oh my god, I'm so bipolar today. I'm so up and down today. That's not right.
That's really not how it works.
It wouldn't happen over the span of a day, correct?
Yeah. You don't become manic for like 45 minutes and then depressed for a half an hour. It's not how that works. Some of the symptoms can cause intense mood swings, which is but what I'm talking about now are longer changes in your overall well-being and like ability to interact with the world.
Right.
Like myself, never mind. I have essentially run the gauntlet on my own brain and taken myself up to the highest mania possible, which is resulted in a psychotic break. And then I also went all the way back down in the other direction to the worst depression I've ever experienced. But it happened over the course of 4 months almost. Yeah. I'm just now getting out of the depression that I experienced. Episodes of mood swings can also occur rarely, possibly even once, from what I was talking about with my own doctor. Like, there are people who only experience this kind of mood swing once and never experience anything ever again. Or you can have what's called rapid cycling, where you end up cycling maybe even 6 or 7 times between different things over the course of a year.
What do you mean different things? Like manic
mania
phases?
Manic, mania.
Even say it.
there's mania, there's depression, and then there's your in-between quote-unquote normal state. And those are
Okay.
the three things that you cycle between. And there are people who have it only once, and then there are people who have it happen to them on an almost daily basis. They're moving between their three different states in their cycle. But most people lie within somewhere between that, like a bell curve.
Yeah.
Yeah.
Interesting.
So there are many shades of gray and variations on what can happen. While most people experience some emotional symptoms between episodes, some may not experience any at all.
Every case is subjective.
Yes, it's very complicated, and there's a lot that could go differently between different people. So a person with bipolar disorder may have distinct manic or depressed states, but also have extended periods, sometimes years, without symptoms as well. A person can also experience both extremes simultaneously or in rapid sequence, which is called a mixed episode.
How rapid is that?
That can be, it's not really rapid between, it's more like you're experiencing multiple symptoms from depression and hypomania at the same time.
Oh my god.
Yes, and that's a mixed episode.
That almost sounds terrifying.
It is. Looking back, I'm pretty sure I've gone through quite a few mixed episodes, and they are really terrifying. Sorry if my voice is shaking, by the way. I feel like my voice is shaking so badly.
I feel like mine shakes every episode, and then you listen back to it, and it's not as bad. So you'll be good, because I don't hear.
I'm never going to listen back to it. It's fine.
It's not like you edit the podcast or anything.
No. We're just going to do it once, and we're going to put it up on the internet, and we're never going to listen to it again. It's fine.
Yes.
And like I said, bipolar disorder is, in most cases, treated with medications and psychological counseling, but it is lifelong. There are several types of bipolar disorder as well. They may include mania or hypomania and depression. Symptoms can be unpredictable changes in mood and behavior, resulting in significant distress in daily life. Bipolar disorder 1, aka me. Yeah, this is the one that I got.
I just realized I have two best friends with bipolar disorder.
Yes, the manic self and the depressed self.
We stand mentally ill individuals on this podcast. No sarcasm at all. I know that sounded kind of like sarcasm, but like we stand mentally ill individuals that are actively trying to help themselves and help each other.
That is a huge
I'll put that
thing.
one.
That especially with bipolar disorder that we'll talk about later, because people have a lot of trouble with their loved ones who have bipolar disorder if they aren't helping themselves, and it becomes really difficult to help them and love them. So, bipolar disorder 1. This means that you've had at least one manic episode that may be preceded or followed by a hypomanic or major depressive episodes. In most cases, this mania will, or in some cases, the mania will trigger a break from reality or psychosis. That is the only thing that makes bipolar 1 what it is. Psychosis and full manic episodes are what separate bipolar disorder 1 from bipolar disorder 2, which means that you've had at least one major depressive episode and at least one hypomanic episode, but you've never had an actual manic episode, a fully manic episode.
Interesting.
And we'll talk about the details of what that
hypomania
and hypomania mean. Yeah, cool. We'll talk about that.
I was just about to ask that.
Yes, we'll talk about it, I promise. We've also got cyclothymic disorder, which means that you've had at least 1 or 2 years, you've had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms, though less severe than major depression. So that's cycling on a lower scale, and it tends to happen in children and teenagers more. And then there's also other types. These include, for example, bipolar and related disorders, including certain drugs or alcohol, can cause them. You can go through a bipolar cycle that's due to drugs. There's also Cushing's disease or multiple sclerosis that can cause you to have issues with things that look like bipolar disorder. Isn't that crazy?
Yeah, that is interesting. Like, it's almost masking as bipolar kind of thing.
Yes.
Okay.
Bipolar disorder is just manic depression. Anything that presents itself is manic depression, which is a very wide range of things, because apparently it's something that humans kind of do. Just kind of do sometimes.
Like flow through.
Right,
like the ebbs and flows of your life. I kind of was thinking that too. Like, where do you draw the line almost?
I know.
That's
why I feel about cyclothymic or cyclothymic.
Yeah, the one with teenagers and kids.
Yes.
Yeah, that one was weird for me too, because it's hard to diagnose children and teenagers, I feel like.
Yeah, I agree.
Because their brains aren't even fully developed yet.
Right, which is why you can't really diagnose them with bipolar 1 or bipolar 2.
Oh, so that's why they have that like third category.
Yeah.
Okay.
And also, just for a note, bipolar 2 is not a milder form of bipolar disorder 1, but instead a separate diagnosis completely. It doesn't mean that you have like a less bipolar or anything like that. That's not how it works. And the manic episodes of bipolar disorder 1 can be very severe and dangerous, but people with bipolar 2 can be depressed for longer periods, which can cause severe impairment. Does that make sense?
Yeah, seems like from that it makes me think like bipolar 1 sounds like it hits you real hard and fast kind of thing. Yes. And then bipolar 2 is like longer periods of either
people
mania
with bipolar
or
2 tend to just period. Yeah, they tend to think they just have depression because they don't understand the hypomanic periods and what they mean. Yes.
So like their hypomanic, would that be like maybe what they would perceive as normal?
Yes.
Okay.
That's possible. I was perceiving hypomanic periods as normal.
Interesting.
I know that I was. Yeah.
That's crazy.
Just like maybe a little amped up, but no, I used to think that was just normal. Speaking of hypomania and mania, those are two distinct type of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. And mania may also trigger a break from reality that requires hospitalization. Like me.
Fun.
Yeah. Both a manic and a hypomanic episode include 3 or more of these symptoms.
Oh, real quick. I was just going to say, if you guys want to learn all about hospitalization for mentally ill individuals, go listen to the episode. A couple episodes back. We talked about the history of mental health care.
Yes, ma'am. That is the episode title.
Plugging our own podcast in the middle of the podcast.
Gotta plug it. Gotta get that plug in.
That fat plug.
That plug.
Plug that plug. Tell me about hypomanic, the episodes.
Yes. So hypomanic and manic episodes must include 3 or more of the following symptoms: abnormally upbeat, jumpy, or wired, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, aka euphoria, decreased need for sleep, which is a huge one. I was talking to my therapist about this, and she was telling me that sleep tends to be huge for people with bipolar disorder, which was very true for me. An unusual level of talkativeness is also seen, racing thoughts, distractibility, and poor decision making. For example, going on buying sprees, taking sexual risks, or making foolish investments
over a long period of time. Again,
this is okay. Yes, kind of. Mania tends to last shorter period of time than depression does. Mania tends to last weeks, while depression tends to last months.
Interesting.
So and isn't like you're just going out buying shit and making terrible decisions for like an entire month or so. It can be smaller than that. It can be just any sort of like really irrational behavior. Does that make sense? Am I making
no,
any
you
sense
are.
at all?
I just wanted to clarify that it was over a long period of time, because if you just put like
Right.
these, like I could experience almost all of these during a panic attack, and that's not
Right.
the
This
same
is like
thing.
multiple days to weeks
I just
to
wanted to
possibly a
clarify
month.
for my own self
I just
and
thought
for
long was
listeners.
I just thought long was kind of a subjective term because it doesn't last mania does not last as long as depression does. Depression is a lot easier to sustain, which, talking about depression, a major depressive episode includes symptoms that are severe enough to cause a noticeable difficulty in day-to-day activities. And episodes must include 5 or more of the following symptoms: depressed moods such as feeling sad, empty, hopeless, or tearful. In children and teens, depressed mood can also show itself as irritability.
Well,
A marked...
I'm sorry, just that last.
Because teenagers are mad at everything.
Teenagers are irritable as hell, like, all the time, though. So that's like...
I think that's... Yeah.
It's hard to say that just means you're depressed. They're reaching a little bit.
Okay.
She's reaching, Your Honor.
Okay.
Not you.
You know what?
Not
you.
You
Can talk to the Mayo Clinic about it.
Yeah,
You can talk to the Mayo Clinic about it. There's also a marked loss of interest or feeling of no pleasure at all, or almost all. What the fuck does that even say?
See,
marked
Mayo
loss
Clinic's
of
fucking
interest or feeling no pleasure in all or almost all activities. Significant weight loss without dieting. I'm so dumb. Without
well,
dieting.
I mean, I would hope it would be without
weight
dying.
gain.
Oh,
weight gain or decrease or increase in appetite. So like nothing, you're just losing weight for no reason. It apparently is a symptom of depression. Either insomnia or sleeping too much, either restlessness or slowed behavior, fatigue or loss of energy, feeling worthless or excessive or inappropriate guilt, decreased ability to think or concentrate or indecisiveness, thinking about or planning to attempt suicide.
I've also read with the weight loss thing, a lot of the time these super depressed states can accompany eating disorders, so that might be where that comes from. Well, that's definitely probably where it comes from.
I see where that you're saying that. I absolutely get that. And honestly, I know we just kind of explained depression to a bunch of people who probably have heard that definition of depression over and over again. I'm sorry about it, but I just needed to get it out for the podcast because that's what we were talking about it right then. So let's talk about mixed episodes.
I mean, some people don't know what depression is like. This might be your first time hearing about it. I would be shocked.
Yeah, and it's not just emptiness and sadness.
Yeah, it's long periods of time.
Yes. And also there are mixed episodes which are possible, and I think I have been going through those pretty recently. Especially I was going through one when I first got out of the hospital. And if you are in a depressed state with mixed features, you will meet the full diagnostic criteria for a recent major depressive episode, but will have also experienced at least 3 symptoms of mania or hypomania during the same time frame, which is like an excessive or elevated mood state, inflated self-esteem or grandiosity, racing thoughts, decreased need for sleep. So you can have all the symptoms of depression and then also have symptoms of hypomania. And that is what's a mixed state.
Okay.
Doesn't that sound terrifying?
Yeah, but it also sounds less terrifying than I thought before.
That's fair.
It sounds more handleable, I'll put it that way. It still sounds terrifying, but
I get you.
Yeah.
Though, unfortunately, yeah, and it's not easy. A lot of individuals who have been recently diagnosed with bipolar disorder tend to reject the diagnosis, feeling overwhelmed with the thought of having an illness, which who do I get that?
That's sad, though. I understand it, but it's sad.
Some people tend to wait it out even struggling with several episodes before they pursue treatment. And there are also a lot of myths that tend to deter people from wanting to get help with bipolar disorder. So let's talk about some of those after the break.
Woo! Catch you later after that break.
I hope you enjoy. And welcome back. So
sorry for my do.
I wouldn't be.
Okay.
Don't be.
I'm not then.
I love it.
I'm not. I take it back.
Yeah. So we just talked about what bipolar disorder is and what we know about it from like a clinical standpoint. And now I want to move into what it's actually like to live with bipolar disorder, starting with some myths about the disorder itself. There's a lot of rumors that make no sense.
Okay.
When you look at it clinically.
So we're going to get into the tea. We got the tea here.
We have some tea.
We're going to spill all the tea.
Yes. The first being that individuals cause their disorders.
What?
I don't understand. I feel like this is a standard myth for almost anything mental health related.
I was just going to say, it sounds like what people say when people are like, depression doesn't exist. You can't just be sad for a long time.
Yes. And people say that about bipolar disorder. But of course, no, it is caused by complex interplay of genetic and biological factors along with environmental. The second is that you can will yourself out of your mood swings.
If only. I would love to be able to will myself out of a panic attack. Like in the similar vein.
If I could have willed myself out of whatever was happening, I would have. Right? Are you fucking kidding me? I spent 12 days in the hospital. Don't you think my ass would have been done gotten out of that shit?
Yeah, it was not the best in there either, y'all. Nobody that could optionally get themselves out of there would choose to stay.
I asked them. I was like, so can I sign myself out if I sign myself in? And they were like, no, the doctor has to clear you.
That's and so fucked up to me.
New mission, get the doctor to clear my ass. Let's go. That's what it was. So this is also untrue because, left untreated bipolar disorder can wreak havoc on a person's life because it requires both medical treatment and psychotherapy. It's one of those mental health issues that you just have to do both. You gotta have both, y'all.
It's not like that video. Have you ever seen the video where he has the 2-in-1 shampoo and he's like, I don't need to buy both? Have you seen that? No. Oh, okay. Me and my roommate joke about it all the time, but this is rather to take another pop culture reference.
You need to buy both, is what you're saying.
I'm saying, ¿por qué no los dos? Like the taco girl from that commercial, remember?
Yes.
Why not both?
Why not both?
Why not both? ¿Por qué no los dos?
I mean, the only reason is because the medication sucks, which we'll get into that in a little bit. Another myth is that you can't really be normal on this or with this disorder.
You'll never be normal.
Well, welcome to your new normal, you fucking son of a bitch. Shut the fuck up.
You fucking son of a bitch.
I hate me.
I love you.
So many patients in the beginning feel like they won't be able to accomplish their goals, but that bipolar will prevent them from getting married or getting the job of their dreams. Dr. Riley Harrington says, but she adds that life why don't I have her credited anywhere? I'm just realizing this. I have this quote from a person that I just have hanging out, just with nothing.
Just
With
just
nothing.
hanging. It's just chilling.
Just chilling.
Her
So this
name is Riley.
Harrington person. Riley Harrington is the
Oh,
last
that's
name.
it's a dash name.
Yes.
Probably from San Francisco. No shade. No tea, no shade.
Really?
I only say that because of the South Park episode where they sniff their farts.
That's funny. That's so funny.
And they all have hyphenated names.
Well, I have no idea where she works or what she does because I haven't credited her with anything anywhere because this is a professional podcast.
So for now, we're going to say she's from San Francisco.
Okay. She says that even though it requires changes, you can still pursue your dreams.
Yes.
For instance, her student patients might take fewer classes every semester and take longer to graduate, but they still can achieve a college degree. Or how we were able to bring the podcast back to life and like still do this again. I know that like this episode's been tough for me so far, but I'm trying as hard as I possibly can to get through it.
Bitch, you are doing phenomenal. What are you talking about? If it's been tough, it's not that easy to tell, just saying.
Oh, I appreciate it. The whole point.
There was a cat tail in front of Emily's face just now. We do Skype when we, because we don't record in the same location, and her cat's tail was just all I saw for like 5 seconds. It was kind of fun.
It's okay. Tucker just wants to be the center of attention. Like
typical Aries.
Oh my god, he is an Aries.
He is?
Yes, they were born on Friday's their birthday.
That's awesome. That's awesome.
Oh, that's funny as shit.
How are we feeling about Aries season?
Aries season is upon us, is it not?
Has it started?
Intense.
It starts soon.
Oh.
Has it? Or does it?
I have no idea.
Me either. I'm not in Aries.
I don't know.
I think we're in Pisces season right now.
We could check. We're in the Google Doc for that has here. Let me see.
Oh, you mean?
Well, hello everybody. We're gonna look through and see.
We know that zodiac information is very pertinent to everyone's knowledge, and we want to acknowledge you guys that we care about
the 21st.
It starts the 20th. Okay, so we got a few days before Aries season.
We got a couple days.
Wrapping up Pisces season, and I only knew that it was Pisces season because of Doll's Kill. They're doing like a seasonal.
Keeping me up on whatever the fuck astrology is happening right now, and I don't care. I really don't care, but you know, I'm here for it. I'm here.
I'm excited to see what they do for Cancers because these Pisces clothes. I sent it to Emily. I sent it to my our group chat with us and Allison, and it was like Pisces girl, and I was like, if this said Cancer girl, it would be so fucking offensive. You can't just have and it was like pink too. It was like pinkish purple, I think.
1000%
Cancer! 1000% Cancer! Like, no! Most t-shirts that talk about cancer say fuck cancer. You know what I mean? Or like something along those lines. Like, let's kick cancer in the ass. Let's beat cancer. You know? And I'm all on board for that. But I'm just curious to see what they're gonna do. Probably gonna be a lot of crab theme. Because we crabby. He's an emotional ass bunch. The Cancers.
We have truly come back.
The pod is back. Anyway, what were we talking about? Bipolar? Bipolar
disorder before whatever the fuck just happened. I'm not sure what's going on anymore. But there's another myth. We have 2 more myths about bipolar disorder. One is that it's easy to diagnose, though actually Elizabeth Brondolo, PhD, clinical psychologist specializing in bipolar disorder and professor at St. John's University in New York, says that it's often very difficult to diagnose bipolar disorder based on an initial visit, even a prolonged one. And this typically occurs because our self-aware changes with mood. Does that make sense?
Yeah, also
I keep if things make sense.
No, it does. No, and I get that because when I do the outlines, and sometimes like when you're just reading it, you just kind of are reading it and not really thinking about what you're reading, and then you're like, wait, does that make sense to you? Because if it makes sense to you, then I've done a good job. That's how I am anyway.
Yeah.
But yeah, that does make sense. And I was just going to say...
confident these days.
I was just going to say...
Reading the outline, you're just so confident these days. You power right through it, and I'm like, God damn.
That's because I've done it so many more times than you.
That's true.
Bitch, you about to do all the outlines. You're gonna do them all now. Hell yeah. Just kidding. I'm doing them on next week, and I'm really actually excited about next week. But I was gonna say, bipolar, getting back to the topic, it obviously has to be difficult to diagnose because you can't just see one manic phase and automatically assume,
right,
that they've gone through... I don't know, and it's hard to judge that based on you have to know the person.
Yeah, therapy is probably the place that they would be able to see it the quickest because it's constant. It's like a routine.
Mm-hmm. Oh, God bless.
I'm so sorry.
No, why?
I'm a mess.
You know that a little bit of Satan just went into you. That's what happens when you sneeze.
Is that why you say bless you, you fucking Catholic?
That's what the Catholics do. I only said bless so because I didn't know what you believe. See, I'm being considerate here.
Yes. Okay. I have more to talk about when it comes to like bipolar being easy to diagnose, and it's along the lines of what you're saying, because it can be hard to translate the experiences and moods you have into the symptoms identified in the DSM or other scales of being able to diagnose. Brondolo, who also co-founded or co-authored the Break the Bipolar Cycle, a day-to-day guide to living with bipolar disorder, and says, for instance, what might appear as confidence and clever ideas for a new business venture might be a pattern of grandiose thinking and manic behavior. While you're focused on your business experience, others notice your mood and behavior, Brondolo said. Same with irritability, a symptom that often goes unrecognized. You tend to be more focused on feeling frustrated than looking inward because it might not be, and because you might not be a reliable reporter, you talk to loved ones and get objective. You need to talk to loved ones and get an objective opinion.
I was just about to say, unless you really talk to people who know that person, you won't be able to judge it, because what may be manic behavior for one person could be depressive behavior for another person. You know what I'm saying?
Right. Something that my therapist asks me all the time is, have you talked to Mike about that? Or have you talked to Jamie about that? Like, if I bring something up in
I feel like I say that to you. I feel like I say that to you about Robin. I'm like, have you talked to Robin about that one? Because I don't know how to answer any real questions.
Dude, I feel you on that. She's a fucking genius, and I love her.
Dude, same. I wish that she would have gotten to be the one to help you in the clink. The clink.
Yeah, I'm not sure why that didn't get to happen, but whatever.
At least it's done and pasted.
Over now.
This episode would not have even happened were it not for that experience. So,
right, that's true. And speaking of having to be in the clink, the last myth is that the medical treatment is worse than the disorder, which is, some people perceive medication as worse than the illness. Although some people can experience a bad reaction to certain medication, you don't get hooked on medication like you would a street drug, Monica Ramirez Basco, PhD, a clinical psychologist at University of Texas in Arlington, says. And she's also the author of the Bipolar Workbook, Controlling Your Mind and Your Mood Swings. In fact, she says medication is key for treating bipolar disorder.
That's very subjective to bipolar disorder, though.
The specific
Yeah,
for,
I was gonna say, because when she's saying you don't get hooked on medication, if you do, just not when it's for what you're meant to be taking it for, such as
right, because
bipolar
the
disorder.
problem, yeah, because the meds kind of suck, and that's the way it is. I'm sorry, that was not a good point.
It's not taking a medication isn't worse than living through possible mental breaks.
That's true.
In my opinion.
Yeah, I still feel like I'm not totally back in my own brain, and I feel like I'm not the level of person that I wanted to be and was trying to become, and I feel like I've been set back a lot, which is really hard, and the only thing I feel like I can blame it on is the medication sometimes.
I understand that, and I think that even though it's hard, you're gonna have to not focus on going back to what you were. You're gonna have to go forward, because you can't ever technically go back to what you were. You're a different person now that you know what you know. You know?
Yeah, that is very true. Elizabeth Brondelot also says that many patients do have positive experiences, though. Like what I've had is ultimately a very positive experience. For one of Brondelot's patients who worked in a supportive environment, telling her boss allowed the patient to be herself and do her job more effectively. However, every workplace and family member is different, and she suggests talking to first consulting with your therapist or doctor. Also, to examine your concerns, you have to ask yourself, what am I worried about? And how can I potentially be harmed? Consider turning to a support group to learn about other patients' experiences. If you're ready to disclose your diagnosis, be straightforward, they also say. It's helpful to give information about the disorder since myths are everywhere. And I also want to discuss what it's like to love somebody who has bipolar disorder.
I love somebody who has bipolar disorder.
That's adorable. Is it me?
Yes, and I have actually another person actually too. I have loved two people. I can't just say one now. Now I look like a dick.
Oh, that's
but
adorable.
There's two that I know of anyway. I mean, shit, there could be people that you know of that have it that you don't even realize. Because, like, I don't know. I wouldn't realize. It's not like something that you can...
Unless you see them when they're manic.
Even then, though.
And, like, they're really manic.
I guess, yeah. If it's super...
Because depression is a lot easier to hide.
Right, you're right. Also, it depends on how manic you get, I guess, too.
Yeah. I found an article from this woman named Sarah, which I'm guessing is a pretty just like basic anonymous name. And it's an article about being married to somebody with bipolar disorder. And she says the first thing that she had to learn, which took her far too long to learn, and she's still yet to fully master it, is the fact that her husband is not the enemy, for want of a better word. It is the illness. When he's ill, when he is ill, he is precisely that, ill, not rude, obnoxious, nasty, stupid, or deliberately hurting those around him, stubborn, nor any of the numerous unpleasant things she wants to call him, and when she feels like she wants to get off the roller coaster ride.
That's yeah.
It scares me.
Yeah, that's rough, because that's a different type of... That's different than what I've experienced with you, at least.
I know, and I feel...
That's more scary, I think, almost.
It makes me feel almost shitty, because I know that I've taken people that I love on a bit of a roller coaster ride as well. And that's really hard to, like, completely...
Yeah, but for me,
like be able to hold as an idea and not feel really shitty.
No. See, for me, my experience was like you made me think there was a conspiracy, so I spent a little bit of time going on looking for these conspiracies and shit, and then
no, that's so bad.
That's about it. That's literally about it.
That's so bad.
It was funny though because you're like, there's like a secret underground hoe mafia, and I was like, bitch,
dude,
and you're like.
I'm like,
start.
I don't even remember.
I remember you just being like, start there. And I was like, where? What are you talking about? Where?
Dude, I don't know, man.
It was just, it was more entertaining.
I don't remember any of it.
More entertaining than anything. And the story that you just read sounds more uncomfortable to deal with and more scary.
Yeah. She also says that it took her many years of going to social events either on her own or with her and her children because she realized it's really not her place to make excuses for his absence. It's exhausting to try to think of something else to say and remember what she used the last time, and it's ineffective because you're going to be constantly arriving at things on your own. People are bound to talk and often leads to guessing about what could be really going on. And the last thing she needs is to be the subject of gossip, however well-meaning, among her social network. So apparently she just dealt with a lot of being alone and having to do things on their own, which is not what I have to deal with right now, but there may be periods in which I have depression overtake me and I need to be by myself or like not be able to operate, and that's really scary too.
That's a thing that is hard for people. I know being someone with depression, not necessarily bipolar, when you are like really depressed and you just want to be alone, I know it's hard for people around me to have to deal with that too, because like I can be a dick to them even though I don't mean to be, misdirect my anger kind of thing or whatever, what have you, and it can be rough on other people, but you have to realize that it's not them trying to be mean, it's them that's their disease is what she's kind of, I think, trying to realize.
Yeah, and she's also trying to figure out how to operate in her social circles while her husband just can't. And she says that she doesn't exactly, shout her husband's condition from the rooftops, or she doesn't tell it to new people that she meets, but it's no longer something that she has to actively hide. And that's the best thing that she's found to be able to do for herself. Letting the wonderful people who are closest to her have changed how she lives her life now. And that mirrors a lot of the advice that I was given about my own condition and how I feel about talking about it, because I have to be open about it or it's going to drive me crazy,
That's how I felt about, really, I feel that way about a lot, almost, if not all, mental health issues. It's better to be open about it than to hide it.
Right, because hiding it just leads people to gossiping, unfortunately.
Or it leads you to internalize things. That's how I was anyway. I would internalize, like, for example, we've talked previously on this podcast about eating disorders or self-harm that we've been through, and like, if I didn't talk about that stuff, I think I would almost still, I would do it more. I would do it. Like, I would still be doing it maybe, because making yourself accountable for having that makes you accountable for treating yourself.
Right. No, I get that.
I don't know. It's just, I know it's a completely different lane from like this, but it made me think of mental health as a stigma in general, how people try to hide their mental health problems rather than just lay it out on the table. Like, not necessarily have it be the first thing that comes out of your mouth, like this woman, Sarah, said in her story, but it's not necessarily something you hide either.
Yeah, I think that's really smart.
Yeah, I don't know.
Yeah. I want to move on to something more positive, though. Talk about some tips on how to just love yourself and keep yourself accountable if you have bipolar disorder. And these all are just supposed to be helpful tips. Emily's helpful tips.
Hampton's helpful hints.
Oh, nerd.
These are for Emily's bipolar buddies.
Yes. So, the first is that you have to be patient because everything is gonna be fine, but you have to fucking chill out. And that's
so
what Mike
hard.
kept telling me. That's what everybody
But
kept
it's
telling
so
me. They were
hard.
like, you just need to
It's
chill.
so hard to do.
And I was like, no, it is. You can't expect an immediate cure. You have to have patience with the treatment process and let time do what it needs to do for you, because meds are hard.
Also,
meds are really hard.
Meds take time to work too, so that's also
yes
something patience comes into play with.
And while you're being patient, you have to communicate with your treatment provider.
Like you did.
Yes, your treatment program will change over time, but you have to keep in close contact with your therapist or your doctor or both, and talk to your provider if your condition changes or needs changed, and be honest with your symptoms and any medication side effects, which is what I employed when I was dealing with my depression, because my depression got really, really bad there for a second. And it was so nice to have a therapist there that I can talk to every week and get some stuff off my chest about it.
Yeah.
Also,
agreed. Sorry.
Yes. Also, no, you're good. You need to take your medication as instructed if you're taking medication. You have to follow all the instructions and take it faithfully. Don't skip or change your dose. Don't do any of that until you've talked to your doctor. Like, if you are having issues taking your medication, that is something you need to talk to your treatment provider about.
Yeah, and also, you don't want to fuck with drugs that are messing with your brain.
Yeah, no.
Especially.
It's electro jelly up there, guys. It's just electro jelly.
Make sure the professionals are dealing with it.
Yes. You also want to get therapy if possible, because medication may be able to help you manage some of your symptoms of bipolar disorder, but therapy teaches you skills that you can use in all areas of your life. Therapy can help you learn how to deal with your disorder, cope with problems, regulate your mood, and change the way you think, improving your relationships.
Anybody, not just people with bipolar. Anybody can get therapy.
Right.
You should get therapy at gmail.com.
That's where you can email us. Whatever you would like. Please email us. We're so lonely.
Sorry. Keep going with the what you should do. Helpful hints.
This next one is one of my favorite. It's been huge for me because I'm like re-engaging with my family and like trying to spend time with my friends as much as possible. And that's staying connected, because the more you isolate yourself, the more you increase the risk of mood changes going unnoticed and jeopardizing your health. Lack of connection to others can also put you at a risk for a depressive episode. So don't hesitate to assemble a team of professionals to provide guidance and insight. Doctors, counselors, and any others can be a part of that social system. Many people can also find attending a support group for people with bipolar disorder can be invaluable. Staying engaged with friends or family and members of your community can also play a huge role in being able to give you that support that you need. But staying supported, staying connected, really engaging with your network.
Yeah, I think that's important. That's important for sure, especially in all walks of life, but especially in a case where you have a disease that I don't like the word disease because it sounds like it has negative connotations.
It's a disorder.
That's the word. Where you're, it happens over long periods of time, essentially. So it's something where you'd have to be around that person for at least a while. Like, you can't just, it's not just like somebody you see. It's not an acquaintance or like, I don't know.
Right. No, I feel you on that.
I guess even acquaintances could notice it, but like,
I feel like that only happens when you are like super out there. That like
True.
If people are noticing like this bitch is fucked the fuck up, then you're probably giving off some sort of really crazy vibe.
Yeah, that's fair. That's yeah, touche.
Another thing you want to do, like what Jamie and I tried to do for each other and somewhat for the people who listen to this podcast, who want to educate yourself.
Definitely for the people who listen to this podcast, we definitely try to educate.
We try. We're just a couple of amateurs, but we're doing the best we can. Education starts with learning the symptoms of manic and depressive episodes and being up to date on the research-driven treatment options for bipolar disorder. You also want to share your questions with whoever is in your support system and ask them what resources they recommend you read or gather. Understanding the illness can help it feel more manageable and assist you in identifying symptoms before they get worse. And also, along with educating yourself on what the symptoms are, you want to track your symptoms. Many people with bipolar disorder find it useful to keep a daily log of their mood, thinking, and behaviors, which if you are able to catch small changes in these areas, then you may be able to stop or decrease the intensity of a mood episode before it worsens. You can also track stressors or behaviors which trigger a mood episode, such as a lack of sleep, relationship conflict, school, work, or stress, substance abuse, or seasonal changes. The more accurately you can report these changes to yourself and your doctor, the greater chance you have of stabilizing your mood. That is so hard. It's so hard, but it's worth it. It's hard, though.
Yeah, I was just going to say, this is kind of what I try to do with my panic attacks, which, yeah, it is very hard, but in the end it helps. And it helps very slowly. Don't think that it's going to instantly like help with stabilizing your mood and these changes, but it'll work slowly. It's been helping me.
You gotta know what you're up against.
Make yourself a bullet journal. They're fun.
I need to make myself a bullet journal.
Even just like a regular journal. Like I have a list journal, and then I have a journal of like day to day that I write in every day.
Yeah. That's adorable.
Thanks.
Jamie and her adorable coping skills. That's the next one. Engage in your coping skills. Because in addition to alerting your counselor or doctor, you can engage in your own coping skills to control symptoms or reduce your risk for a mood episode. Redisk. Yeah. Having a list of coping skills can be useful, and it might prove difficult to generate your ideas if you feel a lack of control. But if you put the time in before you have some sort of mood episode, you can go back to it later. That's why people have things like bullet journals.
Right. You can notice trends easier that way if you have it like right in front of your face. Human memory is only so good.
Another one that my therapist is really big on, and that I'm now very big on, is establishing a routine. Perhaps the greatest coping skill for preventing mania or depression is an establishment of a healthy daily routine. You might be taking medication consistently and accurately, getting consistent and sufficient sleep that can reduce your risk of mania, getting healthy exercise, and being able to improve your stabilize your mood. But like, you have to schedule the regular times to allocate to that, and also to your family and friends, and attending doctor's appointments. And if you can turn that into a routine that you do every day, that you do at the same time every day, and that is some chugga chugga choo choo you got right there. some what's the word?
I don't.
Some energy.
I think I can. I think
momentum.
I can.
The momentum is the word.
I was only thinking about planners when you were saying that, because I can't have a routine without a planner, kind of thing.
Really?
Yeah. No. Yeah. Really. I mean, it's not necessarily that I can't have a routine. It's like that I can't like plan. I can't remember when I have things to do, or like when. If I don't write it, like physically write it down, I don't remember shit. Like, I can't even put it in my phone.
That's interesting.
I gotta have a planner. I gotta write that shit out and see it.
I put everything in my phone.
See, and that's my mom does that, and like I feel like the grandma in the relationship, because I don't like using the phone for that. But I don't know. Writing stuff down helps me a lot with that, and like penciling in times for things, so that you can like plan times for your like routine things or what have you.
That's really smart. Huh. And the last one I want to talk about, the last tip, is you gotta also develop a crisis plan, because there are times when even the best routine and set of coping skills may fail to prevent a mood episode from escalating. It is important, even when you're feeling good, to go ahead and develop a crisis plan so you can activate it when you feel out of control. Create a written plan with a list of people that you can contact in emergencies, as well as information about the medications and warning signs and symptoms. Also, you want to include a list of hotline numbers you can call if you experience suicidal thoughts or psychotic symptoms. Finally, leave a reminder to yourself that you can always call 911 or walk into an emergency room or ask a loved one to get you help if other measures fail. That is okay. You can do that. This is a part of a crisis plan. And that's really the very last straw. After that point, you have to turn yourself over to other people who know better and that can help you. It's hard to do sometimes, and it really fucking sucks because the hospital blows, but it's worth every bit you put into it.
Ultimately, it's going to help you.
It really is. That's what it's designed for. It's designed to be there to help.
It's a resource. Living
with bipolar disorder can oftentimes be discouraging and very distressing. There are still, however, some things you can do to help yourself be positive and get yourself through difficult situations. The most important one for me has been mindfulness, trying to stay as tethered to the present as possible. There are lots of unknowns with bipolar disorder, and it can be daunting to think about your entire future as a cycle of mania and depression, but it doesn't have to be that way. For one, the magic of sticking with your mental health treatment plan is real, and you only have right now. So stick to it, and everything else will come. This has been endlessly difficult for me, but I am learning the best way I can right now. And my current situation, doing what I can do for myself and those that I love. And isn't that all we can do anyway? You know?
Yeah, honestly, all you can do is what's best for yourself and those around you. I mean, like, ultimately, it's a learning experience. If you need to go to the hospital, you need to go to the hospital, and that's not a bad thing. It never will be a bad thing. Admitting you have a problem is never a bad thing. Actually, it's a strong thing, in my opinion, because the people who can admit they have problems are the ones that are gonna be able to fix their problems, or at least improve their situations. You know?
Yeah, and you're going for medical treatment. Mm-hmm. That's okay. You can't feel as if you can't shame yourself, because that's like shaming somebody who goes to the hospital because they're having a heart attack.
That's what I was just going to say.
You go to the hospital for reasons. Go to the hospital.
Just as valid as going for
like you are going to kill yourself, go to the hospital.
Call the suicide helpline. They'll tell you where to go. We have that at the beginning and end of every podcast. It's 1-800-273-TALK. And like, oh god, yeah. It makes me sad that people even feel ashamed of wanting to get help, or the necessity to get help, I guess.
Yeah, that's fair.
And that's probably why we have lack of funding for help in those areas. But I think it's just as valid as like a physical problem.
It is just as valid as a physical problem, and that's something that's really hard for a lot of people who even have mental health issues to accept, because it sucks. It means your brain doesn't work right.
No, it doesn't. No, it doesn't. It doesn't mean your brain doesn't work right. It just means it works differently, and you need alternate means to make it function better. I guess.
Okay.
I don't know. I try to avoid putting negative words on things personally, because
I appreciate that about you.
It makes, I don't know, I feel like overall I come off as a pessimist, but when it comes to real things that involve your mental health, you have to think as positively as possible. Well, no, that's not true. Realistically. Because if you're thinking as positively as possible, then you're like, yeah, fuck yeah, this gonna work in a second, but it's not. It's not gonna work in a second. Nothing works in a second. All mental health processes are slow.
That's why it's so hard to be a human, because you have to, keep that balance between positive and negative. You have to know what's realistic. And that's hard to know sometimes.
True. So yeah, sometimes even knowing what reality is hard sometimes.
Whoa, dude.
Well, that's all it's a simulation. Okay, anyway, if you guys have any thoughts on this, you can email us at youshouldgettherapy@gmail.com. You can follow Emily and me. We're on Twitter and Instagram. Emily is at EmilyIsHarry. I'm at JMECART. The pod on Twitter, we're at Diarrhea Guys. That's where we'll post like announcements if we ever have any.
Yes, thank you for listening. I appreciate you all being here to listen to me, my triumphant return.
And if you have any stories to share about yourself, with any bipolar stories with you or a loved one, we'd love to hear them at youshouldgettherapy@gmail.com.
Yes. Please. And we love you.
Love you.
Bye.
Okay, bye.